Hello everyone, my name is Courtney Middleton and my partner Sandy Sage and I will be talking about sex addiction, its interactions with other process addictions, and treatment modalities. Today there are many addicts that are faced with more than one addiction. Many of these addictions not only coexist but interact, reinforce, and fuse to become what is called addiction interaction disorder. Coexisting addictions such as drugs and alcohol and process addictions such as gambling, sex, and eating can become chronic and progressive if left unidentified and untreated. In a recent patient survey that Cairn, Pennsylvania conducted, they asked adult patients about compulsive behaviors. 45.4% admitted to having struggled with one or more forms of compulsive behaviors in the last 30 days. This is significant as it points to the importance of recognizing that other addictions may coexist with the chemical dependency, and if left undiagnosed and untreated, leaves the individual at a high risk for chronic relapse. So what is process addiction? A process addiction refers to compulsive behaviors such as compulsive gambling, sexual addiction, gaming addiction, and spending addictions. This is a condition in which a person is dependent on some type of behavior such as gambling, shopping, or sex. This term is often used as a blanket for any behavioral addiction which does not involve an addictive chemical. This is ironic as there are actual chemical processes which occur during the behavior which are very similar to the chemical changes that take place during substance abuse. Sex addiction. Sexual addiction is a serious problem in which one engages in persistent and escalating patterns of sexual behavior, despite increasing negative consequences to oneself or others. Like other addictions, these behaviors continue despite sincere and persistent efforts to stop. Traditional sex addiction is defined as any sexually related compulsive behavior, which interferes with normal living and eventually becomes unmanageable. The American Association for Marriage and Family Therapy reports that nearly 12 million people suffer from sexual addiction in the U.S. Due to the accessibility of sexual material available on the internet, cable television, and videos, these numbers are steadily increasing. Despite common misunderstandings, this addiction is not simply about too much sex. Our research focuses on sex addiction, its interactions with other addictions, and treatment options for the disease. We utilize data and information from research studies associated with this disease. Sex addiction is often associated with internet addiction and other process addictions. We will explore the behaviors associated with sex and internet addiction, and ultimately we will share treatment options and resources available to social workers for working with this population. Many people may not think that sex can even be addictive because there are no chemicals involved. However, the body actually does produce many hormones and neurotransmitters during sex that produce the same chemical high as drugs or alcohol. Sex addicts, like other addicts, often have a background of abuse, such as sexual, physical, or emotional. The purpose for the research project is to provide a communication plan for educating social workers on the prevalence, severity, and correlation with other addictions. Predicting the outcome of treatment is key. There was a report that very little data documents the treatment outcomes, success rates, and predictors of treatment outcomes related to the process addictions, despite the availability of psychosocial treatments. What are the interactions between process addictions such as sex addiction and other addictions such as substance abuse? What are the treatment modalities that are most effective for this disease? These are our research questions. I decided to do my annotated bibliography on an article titled Understanding and Managing Sexual Compulsive Behavior. This was obtained from the U.S. National Library of Medicine. Take a look. Patterns and themes of addictive sexual disorders include fantasy sex, seductive role sex, anonymous sex, paying for sex, trading sex, voyeuristic sex, exhibitionist sex, intrusive sex, pain exchange, and exploitive sex. Most sex addicts have more than one addiction. Take a look at this chart, which shows the concurrent addictions among recovering sex addicts. So what is the significance of this research to the field of social work? This research is significant to the field of social work in that the population includes those individuals who are struggling with process addictions and may not acknowledge this fact due to the lack of exposure related to this category. Social workers will play a key role in the identification of this disorder and the creation of a support plan for the family and treatment plan for the addicted person. Understanding available treatment modalities is important for healing these compulsive disorders. Many professionals have not had sufficient training, and some have not had any, in sex addiction. The prevalence of the disease is expected to continue to grow as the availability of sexual content is more readily available. Education and awareness is key to the social worker population in identifying and understanding the severity of this illness. My partner Sandy will begin to explain our research design and implementation.